Good morning, everyone, and I thank you for joining us today. My name is Katie Stamper, and I'm the project manager for the Child and Family Learning Network. And I'm so happy that you're joining us today for Mr. Andy Crocker's webinar presentation. The Child and Family Learning Network is comprised of 5 communities of practice and 1 being family caregiving. Andy represents the family caregiving community of practice and is a valued member of our executive team. He is also an extension program specialist at Texas A&M University. And Andy today will be discussing what changes you can make to start living a healthier life. As a reminder, please mute your phone using the mute button or pressing *6. And if you have any questions or comments, please use the chat box on the left hand of your screen. And it is with great pleasure that I present to you Mr. Andy Crocker.
Thanks, Katie. I appreciate it. We'll talk a bit about the Child and Family Learning Network. It is a unique combination built on some other successful models for learning networks that kind of combine the best of what eXtension, the electronic front door to the National Cooperative Extension System, has to offer. And so the Child and Family Learning Network is bringing together the family caregiving community of practice, Families, Food, and Fitness, Financial Security for All, Just-in-Time Parenting, and the Extension Alliance for Better Child Care to try to create a single kind of no wrong door approach to family and consumer sciences for the nation and for the cooperative extension system. So you can see on the screen some ways that you can connect with us. We are on eXtension, but we are recently starting a blog, and we're always looking for guest bloggers, and you'll see Katie Stamper's email there in the bottom right. And email her if you're interested in being one of our guest bloggers. You can find us on Pinterest, YouTube, Facebook, and Twitter. Also, if you haven't already, please go to the Learn event. It's number 1599, and that link is in the chat box. And mark that you attended today's session. And then the session is being recorded today, and it'll be posted back to that Learn event. You'll be able to find the resources there, including a PDF of today's presentation. And so please make yourself aware of that. And then if you haven't noticed already in the chat box, tonight we're going to talk about the resources and materials that we shared on today's webinar. As Katie indicated, I represent the family caregiving community within the Child and Family Learning Network. And so my presentation today, while a lot of the points will be applicable to any age group, it will really be focused on older adults and their caregivers. So what I'm hoping we can do with this chat tonight is look at other ways, resources, ideas, information that we can share to take what we're going to talk about today and apply them to people of different ages. So keep that in mind as we go through that my particular bent is going to be aging adults and their caregivers, but that a lot of the points we're going to make could be applicable for any group. Also, I do enjoy questions, so please ask them as we go along. I'd rather talk about what you want to know rather than what I think you should know. So ask those questions as we go along, and we'll get started. So the title of our presentation today is Make Simple Changes to Start Living Healthier Life Today. And this is actually a version of a presentation I did for the American Association of Family and Consumer Sciences at their annual conference in Houston last year. And we're proud to have AAFCS as a partner in the Child and Family Learning Network. And so the presentation that I did for AAFCS was just kind of a general update. But what I've done with this presentation today is taken the points about how to live a healthier life and try to apply resources that are within eXtension, within the Child and Family Learning Network, and within the Cooperative Extension System nationally. I don't have them all, and that's the importance of you being here today, and that's the importance of joining our Twitter chat tonight at 7 Central, 8 Eastern, to discuss more resources that we might have missed. And that's important because the more information and resources we have, the better we're going to be as a group, both the Learning Network and the eXtension initiative. So when we look at health costs in the United States, you know, about 20% of our money goes to spending on health care, be that primary prevention, secondary prevention, tertiary prevention. When I say primary prevention, I mean treating a condition or treating a disease before it happens. Secondary prevention is kind of responding to, you know, a problem right after it begins. So we've noticed a problem and we seek treatment for it. And then tertiary prevention is responding to it maybe after it's become a full-blown problem or when there's nothing else that we can do about it. So between those, about 20% of our spending is on health care. 75% of our health costs are due to chronic conditions: heart disease, stroke, cancer, diabetes, arthritis, obesity. And, you know, with the rise of chronic conditions and the number that we're seeing and with people developing them at younger ages, it really is instructive for us as the population ages, and who better to respond with research-based practical education and information regarding chronic conditions than the cooperative extension system, and hopefully through e-extension, through electronic resources that reach people where they live and work. One of the things that we have noticed, and even groups like Medicare have noticed, that prevention is the best way to spend our health dollars. And so you'll notice, and we'll talk about here in a little bit, that even Medicare, you know, for a long time resisted kind of preventive care. Medicare was a program that was set out to respond to problems when they happen, that they didn't really see the value or they weren't set up to do prevention. But we've even seen a huge payer, health payer like Medicare, switch to a prevention model with how they spend their money, and Medicare beneficiaries have a whole lot of new preventive health benefits that they're entitled to that you know, they may not be aware of, and being aware of what you're entitled to is one of the things that can help our health and well-being. And then we'll talk about some clinical interventions and some community interventions that can help support health and wellness. So when we look at what impacts our health most, we can divide that into 4 domains. And these 4 domains come from looking at some longitudinal studies that have been going on in the United States for, you know, several decades now. And while these won't be applicable for any particular individual, if we pull up and take a 50,000-foot view of the population in the United States, these are going to be pretty applicable to groups as a whole. And so when we look at what our health and well-being looks like, 10% is access, 19% is environment, 21% is genetics, and 50%, a big honking chunk of our health and wellness, is our lifestyle, things over which we have some modicum of control. And through the rest of our time here together, we're going to talk about what each one of these means and some resources that we can use to support those. Now, I thought, okay, so what am I going to do to make this presentation kind of stand out? Because, you know, words aren't really fun, and charts only go so far because a chart can't tell you the whole story. And so I decided that I would tell you the story of your health and well-being through photos. And most of these are photos I've taken and places I've been, and hopefully you'll see how they relate back to what we're going to talk about. So with access, we're talking about being able to understand information, being able to find information, understanding that I need a resource, knowing where to find that resource, being able to find a health provider, knowing that I need to see a cardiologist instead of a urologist, knowing what my insurance will pay for. All of these things make up the 10% of my health status that is access. And I'm telling that story through some pictures here. There's some guy that I know in Egypt. For those of you who've never met me, that is me. But and then the Great Wall of China, and a wheelchair ramp that goes into the subway in St. Petersburg, Russia, and then a cartoon that I think is funny. So we'll start in the top left and we'll work around clockwise. Sometimes, you know, access is a problem because we're rural and inaccessible, and I use the picture of me in the desert to show that. You know, here we are in the middle of the desert. There's nothing around but a bunch of bricks and sand. And what am I going to do? How am I going to get the help that I need? But sometimes all we have to do is change our perspective. So if the person who were taking that picture were to turn around and take a picture the other direction, do you know what you'd see? You'd see an ATM, you'd see a Kentucky Fried Chicken, and you'd see a Pizza Hut. I see Donna said, but there's a KFC across from the Sphinx, and absolutely. So sometimes, yes, we are in a desert. We're in a rural area. We don't know where the services are. We don't know how to find those services. But if we just change our perspective, if we look around, if we change how we look and where we look, we might find that there's actually more around us than we thought. We just have to ask those questions. And so I think that desert picture shows that. When we look at access also, we can look at the Great Wall of China. So the Great Wall of China was built centuries ago, and it was remarkable because it was a defense mechanism, but then it also provided this super highway for the Chinese army to get to places where it needed to be. I mean, this thing helped their troops move and respond quickly and easily. And so if you think about our health system and you think about the resources that we set up, we often set up these super highways that are intended to help people get where they need to be very quickly and efficiently and help them make good use of their information. And that's all fine if we're looking at the Great Wall of China from space, if we're looking at these resources that we set out and these avenues to get to them from space. But then when we get all close to them, you can notice that the Great Wall of China there is crumbling a little bit, and there are weeds that have grown into it. And sometimes maybe it isn't the most efficient way. Maybe we have put up barriers and crumbling pathways in order to access resources that we didn't even realize were there. That doesn't mean that people can't access what we've put out there for them, but it just means that maybe it isn't as efficient and as simple and streamlined as possible. Or so you take a service like 211, which is a great way to get someone in the door for resources and services. But the first thing I say when I talk about 211 often is call 211 from your home phone. Well, what if someone doesn't have a home phone? Okay, so sure, maybe they have a cell phone, but maybe they don't. And so 211 we see as this big super highway to connect people to resources, but maybe it isn't as easy as we've laid it out there for. If we go down to the bottom right, you'll look at that wheelchair ramp that goes down into the subway in St. Petersburg, Russia, and I laugh at that every time I see it. I mean, I would not even want my worst enemy to be on that and try to use it. And so maybe there's poor accessibility, okay? And so with poor accessibility, I relate that to someone being underinsured. You know, we talk about taking advantage of the benefits to which you're entitled, and we talk about the importance of having insurance and being able to access those benefits, but there is a whole class of individuals that are underinsured, that are not able to, they have insurance, but it doesn't quite get them where they need to be. It doesn't quite do them any favors, and that's kind of like this wheelchair ramp. Okay, so it's there, but I wouldn't want to use it, and probably couldn't use it if I had to. And then the last one for access is information. Information is power. You're right, Janie. It does kind of make a mark where someone might have to help someone get through the system. So that's a really good one. I didn't think about that one. Thank you. The last one is information. And so if you see there, it says today's random medical news, and it's these spinners. And so it says coffee causes depression in twins. There is a lot of bad information out there along with the good information, but how do you know the difference? How do you tell the difference? And so finding that reliable information, and that is the way that the cooperative extension system can really make a mark in helping improve the 10% of your health status that is accessed, because we are providing that really high quality information to people and trying to reduce that confirmation bias, trying to help get them to really practical solutions that can help with their problems. And so if we look at the resources that I've put together, that from where I sit, I see as being able to make a good step in the right direction on this, you've got the elder care locator there. Now remember, I'm coming at this from a family caregiving perspective, from aging adults and their caregivers. So you may see other resources and services and information that people need, and that's the importance of joining that Twitter chat with us tonight so we can talk about more resources to support access. But I've got the elder care locator there that'll help connect you with your local area agency on aging, service providers in your area that can help you. Medicare is a great resource, and if you haven't visited the Medicare website in a while, it has come leaps and bounds from where it was several years ago, and it's easy to use and friendly and has great information on it. Call 211 from your home telephone. Here I am telling you to call it from your home telephone, and you may not have a phone, but 211 is a great resource for your area to help find food, shelter, rent assistance, utility bill assistance, things like that. And it isn't just for older adults and their caregivers. In fact, you know, with all the talk of disasters in the news, you know, yesterday and today, 211 here in Texas actually provides an evacuation registry in certain areas of the state where if you need help getting out of your home in the event of a disaster or an impending disaster like a hurricane or something, you can register with 211. So there are a lot of uses for 211 that can help connect you to resources and services in your area. Ask an expert through e-extension is probably one of the most critical and innovative tools that I've experienced in a long time, and actually is a lot of people's front door into the extension system and they didn't even know it. But that actually helps connect people with extension experts from all over the United States in a variety of disciplines, and can help get them access to resources in their area. And then our friends in the Financial Security for All community of practice are running Ask Health Lit, which is an effort